Bonjour tout le monde, bienvenue à ce webinaire de la série Réseau-1. Je vous laisse un petit instant pour arriver au webinaire. Prenez un instant pour écrire dans la boîte questions qui vous êtes, quel est votre rôle, vous êtes dans quelle région. On aime toujours savoir qui est avec nous aujourd'hui. Donc, juste prendre un petit instant pour nous dire un petit coucou. Je voudrais souhaiter la bienvenue aujourd'hui à Mélanie Barwick qui est avec nous en direct de l'Ontario, en fait. Donc, bonjour Mélanie.
Bonjour.
Donc, Mélanie, on est deux Mélanie aujourd'hui. Mélanie est une experte en sciences de l'implantation, en transfert des connaissances, vraiment une experte de renommée mondiale. Donc, on est vraiment très enthousiaste de l'avoir avec elle, de l'avoir qui va nous partager ce savoir un peu, nous partager ce cadre de référence. Juste pour vous mentionner qu'en ce moment, dans la boîte documents à distribuer, vous pouvez aller chercher la présentation que Mélanie va nous présenter ainsi que certains documents qui vont être à l'appui. Vous pouvez déjà les sauvegarder si ça vous intéresse. Tout au long du webinaire, vous allez pouvoir écrire des questions que vous avez, des commentaires que vous avez. On va avoir une période de discussion à la fin. Donc, n'hésitez pas là, à écrire vos questions tout au long du webinaire. On va y revenir. Sinon, vous pouvez aussi lever la main. À ce moment-là, on ouvrira votre micro. Donc, sans plus tarder, je passe la parole à Mélanie pour qu'elle nous parle de ce cadre de planification. Donc, Mélanie, c'est à toi. Merci beaucoup d'être avec nous aujourd'hui.
Merci. Ça me fait un grand plaisir d'être avec vous cet après-midi. Je vais continuer en anglais parce que ça va être une présentation plus courte et aussi parce que j'ai perdu l'habitude de communiquer en français. Alors, we're doing this in English, mais je suis bien heureuse de répondre aux questions en français. On va laisser du temps à la fin de ma présentation pour avoir un peu d'une discussion puis avoir des questions. Bon, what I'm going to talk to you about today is our knowledge translation planning template, le modèle de planification de l'application des connaissances. It's a template that has been available in English since 2008 and grâce à due to this occasion, we have translated it finally, and I want to acknowledge the contribution of the Réseau-1 to helping us with that translation. So thank you to you. So the objectives of the webinar today are to talk about a little bit why knowledge translation is important in the first place, and to review the planning method with a focus on evaluating your dissemination plan. Excuse me. One of the things that is really important to consider in thinking about knowledge translation is it's really two things. It's dissemination on the one hand and implementation on the other hand. And this knowledge translation planning template focuses on developing a dissemination plan. And I'll come back a little bit later to talking about how implementation is different, but if you are planning to implement an intervention, we have other tools and resources to support with that process. So making knowledge translation useful really requires that you have a plan. And having a plan at the start of your project, whether it's a project in the community or a proposal, is really fundamental to ensuring that your research dissemination has traction, that it's effective in meeting what we call the knowledge translation goals or the purpose of communicating your research. We often share research findings with a range of knowledge users, and we also have a range of goals or purposes for why we share that knowledge. Either we want to share what we've learned and inform people, inform their knowledge, or we want to inform research, or we want to inform decision-making on the ground. Sometimes we want to do all those things and go further to facilitate behavior change or practice change or policy change, or to bring an innovation to market through commercialization. So when we communicate the fundamental main messages of our research, we need to not only construct a good main message, what did we learn, but also be clear on why it's important and why are we communicating that information. So that's part of the alignment that I'm going to speak about in a moment. So why do we have a plan? Well, like everything else in life, if you don't plan for something, the chances of it happening are really small. So if you don't plan for it, it's not going to happen. It's also, as you all know, through CIHR, I'm not sure about the Fonds de Recherche de Québec, what their knowledge translation requirements are. It's been a long time since I've been funded by them. But it's a requirement for funding from Canadian Institutes of Health Research, from Social Science and Humanities Research Council, and it might be a little less explicit now in a call for proposals, but it's still there. People, the funders are still asking for a knowledge translation plan. And on the back end of your research, when you're funded at CIHR, I presume the same is true for SSHRC, when you have to do your online reporting of your activities, there's a large section that has to do with knowledge translation that includes questions about what you learned, what you did, who was involved, and also how do you know that you had an impact? So did you evaluate your knowledge translation activities in any way? We want to reach a range of knowledge users, and you know, if left to our own devices as researchers, we tend to talk to other researchers. We tend to only be rewarded for our productivity in terms of journal publications and research grants and presentations. But our research will only live in this very small academic world unless we make an intentional plan to reach out to people who could benefit from the work that we're doing. So we want to ensure that the research actually leads to benefits for people. And those benefits may be symbolic, conceptual, or instrumental. Most of the research we do in health does not lend itself to application that requires implementation. We do a lot of discovery research, we build our knowledge base, we learn about etiology, we develop concepts, we develop theories and models and frameworks. Sometimes that eventually leads to interventions that we can put on the ground to benefit Canadians, but a lot of the time it doesn't. So regardless of where you are on the research continuum, you still need to be thinking about how you're going to disseminate your research evidence, and possibly also think about how you will make sure that your interventions are well implemented on the ground. We need to demonstrate a return on investment, and our funders ask us what were the benefits of our research because they need to roll that up and they need to demonstrate their own accountability. We're sometimes being asked by our own organizations in our performance evaluation, please describe your productivity and describe your impact. And developing a knowledge translation plan gives you the fundamental information, pathway and information you're going to need to be able to describe what the impacts of your research have been for the people you're trying to reach. It also helps us to advance science and practice and knowledge translation if we can evaluate the knowledge translation activities that we're engaging in. So the intention of knowledge translation overall, so dissemination and implementation, and the intention of this specific planning template is to get what we have learned, what we know works, what we have learned in science, out to the people who can benefit from it. The common pitfall that we have, and this I see commonly when I'm on CIHR and other review committees and I look at people's KT plans and their proposals, is that what we have a tendency to do as researchers is to identify the knowledge users, and then in another paragraph, identify the strategies, and we're done. And as you will see in how the planning template is laid out, what you really need to think about is a process that is far more comprehensive. So what does that mean? It means identifying from your research evidence, what are the main messages? Now, a main message might be specifically focused to a knowledge user audience. I could do one study, but shape my message for researchers differently from decision makers, differently from parents or the public. And that's okay, that's what you want to be doing. So what are your main messages? Who are they going out to? So who are your knowledge users? What is the goal of the communication? To build awareness, share knowledge, inform research, etc. And oftentimes we have multiple goals. What strategies will we use to achieve those goals? And fundamentally important to KT planning is, how are you going to evaluate that at the end? How are you going to know that the strategies and the activities that you did that have to do with knowledge translation, not your research strategies, but your knowledge translation strategies, if they were intended to build awareness or shift beliefs or inform decision making, did you get there? Were you able to actually accomplish that? So the planning template is, I think, 5 pages long. It's structured in this way that you see on your screen. This is the French version. And I'm going to go through page by page so you can see the various components. There are 13 components to knowledge translation planning. For those of you following in English, the English slide will follow next, and it should be in your slide packet. So the first thing you're doing is identifying who's around the table to develop your knowledge translation activities whenever you're doing them, and hopefully you're doing them at the proposal writing stage. So who's going to be participating? Researchers, practitioners, members of the public, members of the media, patients or consumers, decision makers, people who are policymakers or part of the policymaking enterprise, private sector industry, funders, people who work in non-governmental organizations. Who needs to be here? And the way you're deciding that is who's going to benefit from this evidence and who has a unique perspective and set of skills to lend to shaping our plan. You then want to identify what sort of engagement, level of engagement and timing of engagement you're going to have. So your participation des partenaires is really, are you bringing them all in early on? Do you have integrated knowledge translation? Or are you really only situating your knowledge translation activities at something that you do at the end of your grant or the end of your project? Or are you doing both? What's the role of the partners? In other words, what do they bring to the knowledge translation development, actualization, evaluation? What are they doing in this group? And do you require any expertise in knowledge translation, either in-house, through other consultants or knowledge brokers, other organizations that might help you by virtue of resources, people, or other resources that they might have? So thinking through, how is this actually going to work, and do you need some expertise is really important. If one of your goals is to change practice or behavior and you're going to be thinking about implementation, you might also be thinking about bringing in somebody who is either an implementation consultant or specialist or an implementation researcher. So this is what the KT planning template looks like, the English version, and it's available for download off of the Hospital for Sick Children website at the link that you see here. So this is just the same information en anglais. A couple of other things to think about your partners and your knowledge users and how they can be helpful. Bringing people in a participatory sort of co-design process can help you with developing your research, fine-tuning your intervention, figuring out what recruitment will be like if it involves recruitment, and how to deliver that intervention. They can also help you think through at the end, as you're constructing your main messages, what really are the right main messages for different knowledge user groups. You know, as researchers, we have a tendency to have in our minds what we think are the important things that came out of a study. But what I think are the main messages from my last research project may not be exactly the main messages for knowledge users that I wanted to reach. They might be focused on another aspect of the research findings. And so when you have those representatives around the table, you can identify what that actually looks like. So where do you need some additional help? They can also be helpful in the sense that they can help you communicate your messages. So they can be sort of a credible resource in terms of accessing your knowledge users. It's oftentimes, well, not oftentimes, but sometimes not the case that the researcher is the best person to give a presentation or communicate or run a meeting or do a certain thing. And they often need to be partnered with somebody who already has access to your knowledge user group, credibility in the knowledge user group, and an understanding of what the needs of that group are to help you with that messaging. So they help you close the gap between the people who are going to benefit from the research knowledge and the people such as yourselves as researchers who have created that knowledge. So the other question that's asked on that particular page of the template is, you know, is this integrated? Is this fin de la subvention? Where are you going to put your efforts? And sometimes it's both. So the next page of the template asks you 3 other groups of questions. One is, who are your knowledge users in column 5? Now, your knowledge users should also have been captured in column 1, where you were identifying who's at the table to plan out this knowledge translation and bring it to fruition. Sometimes this is a good catch to make sure that you've captured all the right people. But you don't always have everybody involved in planning knowledge translation, and there are some instances where you are simply sharing information with a group of people. So this column asks you for questions about, you know, who are you trying to reach? Who's going to benefit from this research evidence? And you can tick off the appropriate groups of people. The next, column 6, asks you to talk about what are the main messages. Now, obviously, when you're writing a proposal, you don't have any knowledge of what you're going to learn in this research if you are successfully funded. But you probably have an idea of what you hope the main message will be. Maybe it's an intervention for parents to manage pain better when their children go for their immunization. And you know that what you will be sharing has to do with here are the effective things that parents can do to minimize pain during immunization at the flu shot. So there's a general concept of a main message that you're going to be sharing. You then need to go further, and this is something you can come back to as you go through your research and you refine your knowledge translation activities, is what are the specific main messages for your, say, top 3 knowledge user audiences. So if I'm sharing that information with parents, what's that going to sound like? If I'm sharing it with primary care doctors, what's that message, and so on. So you're just trying to refine exactly what it is you're communicating. Now here's where the alignment starts to really come into play, because if you look at column 7, what we're asking you here to do is to identify the objective, the goal, the purpose of that communication. And so looking at the English version, what's the goal here? Are you generating awareness, interest, and buy-in through the communication? Are you simply putting information out there so it builds people's knowledge base? Are you hoping to inform decision-making? Are you informing research? Are you hoping that the information that you share will facilitate policy change or policy decision-making or practice and behavior change? Are you looking to commercialize a product? And there's a column here within column 7 to identify the goal for each of your top 3 knowledge user audiences. So when thinking about who your knowledge users are, you want to really be thinking about who needs to hear this, who's going to benefit from it. But you should also be thinking, because you have to consider what format is my message going to be communicated in, what are my knowledge users' preferences about where they go to for information, how they want that information to look. Some people have preferences for hearing things from other people, for reading things, for hearing a podcast, for seeing a visual representation of evidence. We all have different preferences for how we want to receive information. So if you know your audience, you also know something about what their knowledge user preferences are, and also how prepared they are to receive that information and or make decisions based on that information. And it's really clear that the more you involve your knowledge users in the planning for knowledge translation, bring them into the research process early, the more likely they're going to be attuned and open and available to what you have to tell them once you've completed your work. So how many knowledge users are we talking about? Well, depends what kind of research you're doing. People who are doing clinical research or health service research or population health tend to have a large range of knowledge user audiences. You kind of want to land somewhere between precision but pragmatics, really. You know, don't miss anybody out, but only take on as much as you can actually do. It's very possible that your knowledge translation products, the things that you put out there, will be appropriate to be shared with parents and the public, but you might need to do something a little different for policymakers, or you might need to do a little something different for healthcare providers. So be mindful of not trying to do too much, really. What do we need to know about main messages? So main messages are trickier than you think to create, and we do this exercise in our specialist KT training that we run here at the hospital. It's really a great exercise, whether you're thinking about knowledge translation or not, to sit down at the end of your project and try and think about, what is it I learned? What am I clear about? So whether you're going to do a radio interview or a television interview, or you're talking to your best friend, you want to have some ease and fluidity in being able to share a clear, concise, audience-focused message that gives people an idea of what you did, why it was important, how it can be useful for people to know this information. So it's not, you're not communicating the data or the methods, but you're communicating, what does this mean for people? What are the benefits? How might they use this information? How might they benefit from this information? What's important here? What action should be taken? How might it inform their decisions? So you have to give them something a little bit more packaged than your data and your methods, which is what we often include when we speak to other researchers. So the other thing that is in that second page is the notion of a KT goal, and this is really where the alignment comes in. And this is often a component that's missing in a lot of knowledge translation plans. As I mentioned earlier, people have a tendency to write a plan where they describe their knowledge users and their strategies, and there's nothing linking the two. So what are your goals? Are you trying to create buy-in and interest and awareness? Are you trying to share knowledge? Are you trying to inform research? Are you trying to inform decision-making? Those are the gold buckets that you see there. On the blue, in the blue boxes, what you see are goals that really have to do with implementation. So changing practice, changing behavior in the public, informing policy, or bringing a product to market. And it's super important to know what the purpose or the goal of your knowledge translation is, because this is what is going to A, determine what your strategies are, and B, what you're going to evaluate. It's really the purpose of the exercise, the purpose of your knowledge translation. So this is the same thing in English. So what do I have to say about alignment? A good knowledge translation plan is written differently than what I had initially commented on. Who are your knowledge users? What are the main messages for each one with the purpose or the KT goal? What strategies will you use, and how will you evaluate or come up with some metrics that let you know that you achieved those goals? So for instance, the main message for parents is there are strategies you can use in the clinic to reduce pain when you immunize your children. The aim of sharing this information is to give parents knowledge they didn't have, and to create a bit of intention in them to maybe try some of these strategies the next time they're at the clinic with their child. The strategies to be used are, well, we might share the information in a parenting magazine, on a parenting website. We might develop an infographic that gives people a pictorial example of some of the things that you can do to reduce pain. We might give them a one-page description or summary. We would have to work with our knowledge users to decide what the format looks like, based on the preferences of the parents that we're trying to reach. And then how will we know that accessing that information changed anything in them, in the parents? We would have to come up with some way of evaluating that. And I'm not going to go too far down that with some ideas because of the time that we have, but I'm happy to answer questions about how we've done that in other projects. The third page of the planning template covers off what are the strategies you're going to use. And as you can see, the strategies are listed, embedded under subheadings that have to do with KT goal. So what are some strategies that are role-based that have to do with building awareness and sharing knowledge and helping people to make decisions? So knowledge broker, use of champions, use of a consultant, leadership, or partnership and collaboration would be some role-based knowledge translation strategies. You will see the very commonly used and commonly known educational strategies, everything from developing materials to plain language summaries and syntheses and gray literature and publications, webinars, conferences, etc. More and more, we're seeing examples of arts-based knowledge translation. So across the spectrum of the arts, music, theater, photo voice, body mapping, digital storytelling, different ways that are being used in the arts to communicate main messages of research evidence in a way that resonates for some knowledge users much better than our traditional ways of sharing our research. Strategies for informing research, some of the usual things, scientific collaboration, network, some educational strategies there as well, technological strategies that we can use across the board to support any KT goal. On the right-hand side, you see strategies for informing policymakers. So collaborations, using knowledge brokers, and some educational strategies. What you'll see in the bottom middle of this page is a note that identifies that if your intention is over and above dissemination to actually facilitate practice behavior change, you're going to need to use a different planning tool altogether and a different methodology. So it's just to remind people that dissemination planning and implementation planning are two separate things. And it refers you to the implementation game, which we have as another resource and that I will be bringing to Montreal later in the spring. That's just the same page in English. I've already kind of gone through them, but this is just a couple of pages of, how we actually group our strategies based on KT goal. So this is just the same representation of the information that's in the guide, strategies we use for research, strategies we use for policy, and for changing practice. I guess this is the fourth page. Yep. So you're identifying here what your process of knowledge translation is, intégré ou fin de subvention ou les deux. So whatever your options are. And then there's a series of questions that get at evaluation of your knowledge translation. And it's broken down into subcolumn A and subcolumn B. And in subcolumn A, there are a series of questions that ask about whether you have indicators of reach, indicators of use, indicators of usefulness, indicators of collaboration, and so on. So let me break that down a little bit. So you really have an opportunity with a dissemination plan to figure out not just what you're going to do and why you're going to do it, but whether you were successful. And if you don't answer that last question, you may feel like you won the lottery because you didn't have to do that additional work of evaluating your knowledge translation activities. But if you do evaluate them, it's useful in a couple of ways. It's useful as your own impact stories. It's useful at the level of your organization when you are describing what you've accomplished, not just in terms of productivity, but in terms of how people benefited from what you actually delivered. And there's also an opportunity here with evaluation of knowledge translation, particularly dissemination, to write it up, contribute to what we understand is effective for sharing information with different groups of people. Ultimately, you want to do knowledge translation because you want to arrive at an impact. And an impact indicator can be quantitative, it can be qualitative, but ultimately, an impact indicator has to tell you and show you in some way that the people, the knowledge users you reached out to, benefited from the knowledge that you shared. Not just in practice change. Remember, they might have benefited because they're more aware, they have knowledge they didn't have, they can make better decisions, they've informed something about the services they delivered, they're doing things differently. So there's a range of benefit that you want to capture here. So in terms of indicators of reach, there might be how many people requested your knowledge translation product, your tool, your innovation? Where was it distributed? Who comes back and asks for more of it? Who is asking to adapt your intervention for a different purpose? That's an indicator of reach to some extent and also usefulness. Who's linking to your knowledge products and your intervention? Think also of altmetrics as an indicator of reach. Altmetrics really are, they're an alternative, and I don't know if it has an alternative word in French. I just found altmetrics, so I assume it's le même mot en français. It's the alternative to a journal impact factor or a citation index like your H index. And it's a generalized level metric. It can be applied to people, journals, books, etc. And it's a capture of attention. It's a metric of attention. How much attention is focused on this thing that you put out there that describes your research? So it's the tweets and Facebook users and news outlets or media hits that pick it up, all kinds of things all combine into one number. The higher the number, the more attention it has garnered out there amongst everybody. Quality indicators are things like the number or percentage of people who actually received and found the product useful. You have to consider for a moment that when we put things on the web and we're sharing information, we only know who clicked on it. We don't know whether they then subsequently went, accessed the resource and found it useful, or in some way, shape, or form. And it really means that we should go further than clicks and counting clicks to figure out how people are experiencing the innovations that we're putting out there. So are they finding it useful? Are they using it to inform a service or a product? Has it shifted their thinking or how they make decisions or how they do their job? Those are the kinds of things you would be asking here. Indicators of utilization have to do with who actually uses the information. Did they adapt it? How are they using that information, and trying to capture that. Obviously, you're not getting that from your web analytics. You have to come up with different strategies to ask people those questions. The last page of the planning template asks you to identify what resources you're going to need to make this a feasible project, the elements of the budget. So what are the costs associated with your knowledge translation plan? And the last column, column 13, is a place to capture information about your methodology. So this is the methods of your KT plan, not the methods of your research plan. So if you're going to be doing webinars and doing all kinds of things, how are you meeting with people? How are they being developed? Who are your partners? How are they being evaluated? What are the procedures around actualizing your knowledge translation plan? So I'll just summarize with some of the key messages, and then we can open it up for questions and discussion. What I want you to come away from this webinar with is the notion that knowledge translation planning is intentional, specific, and can be standardized using this template. It starts with your research, but it aligns with knowledge users and main message and goal and strategy and evaluation. All of those components have to align together for it to make sense, because if you're just telling me as a reviewer, these are the people, these are the strategies, I don't know what the strategies are in service of. I don't know what the strategies are trying to accomplish, unless you also pin that to a goal. So identifying knowledge users at the beginning, who you're going to involve, means thinking about what are their preferences, what are their needs, but be pragmatic in how many people that you bring around the table. So the knowledge translation planning template, the knowledge translation game, which is a card game that we also have as one of our resources that allow people to simulate a planning experience with a card deck. These are all available to support your work. Additionally available from our Sick Kids website is a knowledge translation plan appraisal tool, which helps you to identify whether you have a good comprehensive knowledge translation plan or not. So it can be used by reviewers. It can be used for your own individual purposes to review how comprehensive your plan is once you think you've finished the planning process. So I'm going to open it up for questions and discussion and hand it back over to Melanie. and hope that was clear enough for everybody.
Merci, merci Mélanie. C'est très, très intéressant. On a Shandy qui est avec nous, qui va lancer un peu la période de discussion. Donc, on peut peut-être juste ouvrir le micro de Shandy. Entre-temps, je vous rappelle que vous pouvez écrire vos questions dans la boîte questions qui est dans le panneau de configuration. Sinon, vous pouvez lever la main. À ce moment-là, on va vous ouvrir le micro. Donc, Shandy, est-ce que tu veux lancer la discussion?
Oui. Hi, Melanie. Do you hear me clearly?
Yes, I can hear you faintly, but clearly, yeah.
Okay, I'll speak up. Thank you so much. I just wanted to say it's a topic of great interest for Réseau-1, our members, in the context of our projects. And I think there's really variable capacity or familiarity with what you just presented. So we're really excited to learn from you and to have you present at our annual day in June. So thanks for that. Je vais transitionner en français pour les personnes qui écoutent. Et je voulais dire que j'ai beaucoup apprécié l'emphase sur l'importance d'aller plus loin que de nommer les utilisateurs de connaissances et d'écrire la stratégie, mais d'aller plutôt vers un plan avec des mesures d'impact. Et les exemples d'indicateurs étaient super pertinents. Donc, pour des chercheurs qui n'ont pas encore l'habitude d'aller aussi loin, sans avoir à maîtriser l'outil au complet et toutes les astuces ou recommandations mentionnées, où est-ce qu'ils devraient commencer s'ils souhaitent commencer à aller plus vers un impact avec les utilisateurs de connaissances? What would you recommend? Thanks.
So where should they start?
Yeah, exactly.
They should start with their proposal planning. So the drivers for change in this are that if they're applying to CIHR, they need to, somewhere in that proposal, maybe it's more implicit these days than explicit, because it's kind of gone under the radar, describe what the benefits will be of the research that they're proposing to do. And that typically takes the form of a knowledge translation plan. This template and the training that it's embedded in, our specialist KT training, really was born out of the experience, or well, we anticipated rather, the experience of researchers back in 2004 when CIHR started asking researchers for this plan, when we knew everyone was going to go, oh my gosh, what is that? How do you do it? And what do we write? So I think it starts with planning. If you are sitting down with your team and you're developing a research plan and a research proposal, you should also be including in that some time to work through an implementation, a dissemination plan. The other reason to do that, so just sit down with your team and the template and have the conversations and lay it out. On our website, there's also a tool called the Knowledge Translation Companion Tool, which helps you then take it from the template, which is more like a logic model, and write it up. What does it look like when you start to write it in prose, in language? And it gives you an example of how I do it. It's not the only way to do it, but it's an example. And then figure out the budget, because we have the luxury in Canada of having research funders that not only want us to do this, but will fund the dissemination activities. If you don't put it in your budget, you know what's going to happen. You're not going to do it. You know, now there's no guarantee you'll do it even if it's in the budget, but if you have a plan and it's in your budget, you're more likely, you know, it's intent for behavior change, you're more likely to actually do it. We have resources on our website. They're now available in French. I think with the partnership that we're developing with Réseau-1, there'll be more and more opportunity to help scale up researchers working in Quebec universities and in primary care, in health settings. So we'll be able to build some champions and some people who can consult more directly. Did that answer your question sufficiently, Shandy?
Absolutely. Thank you very much.
Okay.
Merci. On a une question aussi de Daniel qui demande, de Daniel Chemeux, qui demande Can you spend a little bit more time just describing the difference that you see between dissemination or KT and implementation planning, and kind of where do you draw the line between those two, and you know, what are the main considerations when you're planning one or the other?
Right. So they're very different, and unfortunately in Canada, because we use the term knowledge translation, we never know what people are talking about. In the United States and in other places worldwide, they talk about dissemination and implementation. And I think that's what we should be doing in Canada. It's my mission to change the language, because it's far more clear. So if you look back at, I don't know if I can back up on my slides, but there was a slide with the 8 boxes. And the gold boxes were dissemination goals, and the blue boxes were implementation goals. So the first thing is to think about, what is it at the end of this research that I want people to do with this evidence? If it's knowledge-based, informational-based, maybe you have a project that isn't instrumental at all. You're developing a new concept. You're never going to have anything to implement. So part of the decision about whether it's dissemination and implementation has to do with, what's your research about? What stage is your research at? So if you're developing an intervention that you want to implement eventually, doesn't mean you're implementing it at the end of the first randomized trial. You still have to do your good quality, replicated studies. But at the end of your first RCT, you're going to want to disseminate what you learned. So you always disseminate and you implement sometimes. So part of when you implement, or if you implement, is, what are you asking? Does it lend itself to implementation? Where are you in the continuum stage of research? And then how you do those things is fundamentally different, because implementation involves process, involves preparing organizations and working with organization and implementation teams. It involves paying attention to many different factors that might influence your implementation. It means looking at a range of implementation strategies. I think the compilations now have 73 or 75 strategies. And it means evaluating your implementation. So when you do an implementation study, or that's typically when you would be doing implementation, you're evaluating clinical outcomes and implementation outcomes, les deux en même temps, because you have 2 substantive content areas. I'll continue with my example. Pain management, evidence, does it work clinically, whatever, and implementing that at your immunization clinic means you have implementation outcomes of interest, and you have a process whereby those clinics are going to take up these strategies and make them available and deliver them. Danielle, does that answer your question? Hopefully.
Yeah. I think it does. Just to answer questions that I'm seeing coming in, the website that Melanie is referring to, where all the tools are available, has been just posted in the chat box. So if you want to just click on that link, you have that there. Donc tout le monde, vous pouvez cliquer sur le lien pour voir tous les outils qui sont disponibles que Mélanie a décrits. Il y a Geneviève qui pose une question, à savoir comment prendre en compte le processus itératif du transfert de connaissances, et un peu vos commentaires sur l'itérativité du transfert de connaissances. Vous avez mentionné de planifier dès le départ le transfert de connaissances, mais on sait que ça peut se modifier et être assez évolutif. Donc, je ne sais pas si vous pouvez parler un petit peu de ça.
Yeah, so I mean, when you're planning it at the beginning, it's necessarily going to evolve. But you know, if we're fair, when we look at our research methods, they also evolve. After we get funding, we figure out what's going to work. We change one measure for another measure. Les choses changent de temps en temps. So it is iterative. You're working through it. You're developing a plan, but then you need to, if you're funded, put that plan into action. And that means, you know, following the KT methodology that you laid out. I think there was also an aspect of that question that had to do with, how do you work with your partners? So I think one of the advantages of planning is it really gives you a moment to stop and think about who those partners should be. It doesn't just crop up at some point in your research process. You thought about it early. Sometimes they're people who can lend a perspective, who bring expertise. Sometimes they're strategic partners who have personnel or tools or webinar capacity, right? You might, so in previous projects, we would partner with an organization that was already set up to do webinars. That means we didn't have to pay for it. It wasn't a cost to the project. It was easy. And they already had credibility and they already had access to the people we wanted to reach. So it's not just patient engagement, it's knowledge user engagement in the knowledge translation. And typically, if they're, not all the time, but you might have a project where your knowledge users are involved in the research methods and the KT methods, and sometimes not the research methods, but the KT methods. You have to decide what makes sense for your setting. And you have to kind of make it, you have to find a way to make it authentic. So when you invite people to come to the table in, you know, an academic setting or a hospital setting, and your group of PhDs and researchers, we might be very nice people, and I'm sure we all are very nice people, but it's intimidating for people to come in, and the purpose of them being there is so they can give you input. So you have to be a good host or hostess and make people feel at ease and not rush into the agenda of the meeting. C'est le temps d'avoir une conversation, un café, un thé, comment ça va? You know, that kind of thing. Get people to feel at ease. Let them know that you're a human being. Let them know what you want. I have also found it's really useful when you're involving organizations as knowledge users to have a memorandum of understanding. What's being asked? What's the project about? What is the request of you? How much time are we remunerating you? Are we, you know, what's the benefit for you? How are we going to work? How do we resolve disputes? How do we keep connected? All those things laid out for people, because, you know, sometimes you're not reaching out to them until the end of the project. By then, that was 4 years ago. They don't even remember who you are and what they said they would do. Or sometimes we just reach out to them intermittently. And even for me, projects I'm on that I'm not directly in, when they call me, I'm like, whoa, what's this project about? I don't even remember, right? So it's a bit of an organizer of what the expectations are. Doesn't mean it's a contract. If they want to disappear, they can disappear and not be involved, but at least it's a bit more of a formalization of the partnership.
Merci, oui, puis je pense que cette entente-là d'établir une entente peut clairement clarifier certaines des balises du transfert de connaissances et des rôles de chacun. On a parmi les gens qui sont avec nous aujourd'hui quelques personnes qui sont plutôt des décideurs ou des cliniciens qui font peut-être des travaux qui sont plus près de l'amélioration continue de la qualité que de la recherche, donc qui n'écrivent pas nécessairement un protocole qu'ils vont soumettre aux IRC ou autres organismes subventionnaires. Quelles seraient vos recommandations pour ces personnes-là qui veulent faire du transfert des connaissances qu'ils développent, par exemple, dans leur milieu clinique, qui veulent transmettre à d'autres cliniciens ou d'autres milieux? Est-ce qu'il y a des considérations particulières que vous leur recommanderiez de prendre en compte?
Right. So we actually do a lot of professional development with intermediary organizations and healthcare organizations that don't do research, but where their job is to broker that research. And I think the planning template works equally well, whether it's a research project or an initiative or a project or a program. So it's still, this process is still the same. Pull the people to the table. Do you need partnerships? Who are your knowledge users? Even though the evidence you're sharing is not your own, what evidence are you sharing? So from a synthesis or a guideline or somewhere else, what are the messages around that for the different knowledge users? What's the purpose you have in sharing, et cetera, through the process. What's really important for organizations, and I deal with lots of voluntary health sector organizations, advocacy organizations in different health sectors. They do a lot of production of knowledge translation deliverables. They put them on the web, they produce them in hard copy. It's continuing messaging of good evidence to make sure that people can have it and access it. What they don't do is measure, evaluate whether that productivity, all of that busyness led to anything for anybody. And there's a huge advantage for organizations to do that full circle, right? And evaluate, well, not just did anybody click on this, because what does that really tell you? Not a whole lot. It tells you that maybe some people who wouldn't have found it if it was buried in a journal are now finding it in a way that they can actually understand. That's important. I'm not saying the click isn't important, but what you need to know from those people is, did they understand it? Was it useful? Is it going to help them in any way? Right? So by example, one of the things we're doing now, we're in collaboration with Pierre Puy at McGill University, and Pierre has developed his information assessment method. So this is a questionnaire-based method that he's been using with Naître et Grandir, which is one of your parenting websites in Quebec. And so if you can imagine, sur l'écran, vous avez une page de je sais pas quoi, des informations sur la douleur. Let's just keep with pain, right? For parents, what to do. And if you are the parent, you found it. And if you are the organization, you know they found it because they leave an electronic fingerprint. They clicked, they were on that page for how long? But you know nothing else, because they're going to click away from that page and it's bonsoir la visite, right? So what you want to know is, can they maybe go to the bottom where there's a little box, répondez ici, answer, I think there's 8 to 10 questions that ask about use and usefulness. Was there a problem with the content, etc.? And that gets fed back to, well, goes back to Pierre so he can look at his tool, but it also goes back to the organization and they can make some decisions about that content needs to be adapted. Parents like this sort of stuff. It's helpful for them. And obviously that information is impact information for the benefits stemming from your website to your stakeholders, your funder, your parents, and so on and so forth. And so we're going to start using that now for our Sick Kids About Kids Health parent-facing website, so we can learn more about how parents are experiencing our content.
Do you know where people can find that tool?
Contact Pierre. Right. If you, I know that if you Google information assessment method or IAM Pierre Puy, it'll pop up.
All right, super.
I don't know what his capacity is or what his IP is in terms of how he's working that out, but I think it's, you know, you could do a much simpler methodology, figure out what usefulness questions you want to ask, and have people link to a Survey Monkey or a different kind of survey somewhere else. You know?
Absolutely, yeah. All right, well, I'm seeing the time that's almost done, so I wanted to thank you. Merci beaucoup d'avoir été avec nous aujourd'hui. Je voudrais aussi juste mentionner aux participants, ça a été mentionné quelques fois, mais Mélanie va venir à la journée annuelle du Réseau 1, donc qui aura lieu le 12 juin. Il va donner un atelier sur le deuxième outil qu'elle a mentionné, donc sur le jeu de société, sur l'implantation, l'accompagnement de l'implantation. Donc, si c'est un sujet qui vous intéresse, on vous encourage fortement à venir à la journée annuelle du Réseau 1 pour en apprendre plus sur cet outil-là. Sinon, juste vous mentionner aussi que notre prochain webinaire aura lieu le 27 mars, donc va être donné par Marie-Thérèse Lucier, qui va nous parler de la gestion des échantillons en groupe de médecine de famille. Sinon, le webinaire d'aujourd'hui va être disponible sur YouTube. Si vous voulez réécouter les parties, vous avez des collègues qui n'ont pas pu se joindre à nous aujourd'hui, ça va être disponible pour réécouter. Sinon, on vous demanderait de juste prendre quelques minutes. Vous allez recevoir un sondage très rapidement après le webinaire d'aujourd'hui, juste pour évaluer le contenu ou si vous avez des idées pour améliorer le format ou les différents sujets à explorer dans le cadre des webinaires. Ça ne prend pas très longtemps, mais on regarde vraiment le contenu. ça nous aide vraiment à améliorer le format de nos webinaires. Donc, prenez quelques instants pour remplir ça. Sinon, je vous remercie beaucoup. Je vous souhaite un excellent week-end. Merci encore, Mélanie, d'avoir été avec nous aujourd'hui. Merci à tout le monde. À la prochaine. Merci, au revoir.
Au revoir.